Thank you so much for having me on your podcast. My name is Dr. Jonathan Stea. I'm a clinical psychologist. I've been working full-time in a hospital setting, helping people with addiction and mental health. I've been doing that for over a decade. I'm also an adjunct assistant professor at the University of Calgary, and I'm the author of a book called Mind the Science: Saving Your Mental Health from the Wellness Industry. What inspired me to write the book was when you look to the Canadian Code of Ethics for psychologists, we have what's called a responsibility to society. That's one of our codes, or it's a principle. And in part, that involves promoting and practicing evidence-based care and evidence-based practice. The converse of that is also true. We have a responsibility to correct or debunk mental health misinformation and pseudoscience. It's part of the code, the ethical code that's literally baked into those codes of ethics. And so I really took that to heart right from graduate school all the way up to my training. I've been working as a full-time clinician in a hospital for over a decade now. So that was one major driver that inspired me to write the book. The other reason was that I actually saw, once I got to social media, all of the proliferation of mental health misinformation and pseudoscience everywhere beyond mental health to all areas of health. And that was a real calling because we are just being flooded with false information that really negatively impacts people's health decisions. And I saw a wonderful science communication community online that was doing the same thing, but no one was really doing it in the area of mental health. And so that's where I kind of found my niche, and that's what inspired me. And as well, I would see that misinformation show up at our hospital clinic and see it presented in patient beliefs and how it impacted their health decisions. And that's just not okay. For me, as a first-time author, the most challenging part was probably weaving story and science, because I come from a background of academia where we are writing in very dry, clinical, kind of cold ways that are meant for researchers and scientists and experts. And when you write a commercial book, which is what I wrote for a lay audience. I wanted to reach as many people as I can to make it compelling and interesting and that would capture people's attention. And so the challenge was really to weave that story element with the science in a way that was faithful to the science. And I found that really challenging. It was a learning curve. The way that I did that was to kind of read other books and try to model my style after other authors who I thought did a great job at doing. Well, my approach to science communication is quite different than my clinical approach, and it necessarily has to be, because in the clinical world, the therapeutic relationship matters the most. So if a patient is coming, for example, and asking me to provide, say, a pseudoscientific treatment in the wellness industry, empathically decline, stating that I'm legally and ethically unable to do so because I'm obliged to evidence-based practice. But we would co-explore their beliefs and their thoughts on it, and I would respect their patient autonomy enough to have them seek that treatment elsewhere if they wish. If that patient benefits from that treatment, I'm very thrilled for that patient. On the other hand, there's many patients who will not benefit from that, and they'll be duped by pseudoscientific practitioners and may even be harmed. And for them, I'm quite livid about that. Well, I wrote the book from the perspective of a clinician and a scientist, and my mother's health journey kind of gave a window into the opposite, the role of, say, not quite a patient, but the family member of a patient. And that's incidentally the role that I was in before I became a clinician, because my mother suffered from and still does, from a chronic pain disorder called complex regional pain syndrome, which is a really mysterious chronic pain disorder. And she suffered from those symptoms for years, right since I was a child. And so we really got to experience the full gamut of treatments, both in modern medicine and alternative medicine. And so it really offered the perspective that desperation can be quite intoxicating when people are trying to figure out how to help themselves. And it's not about blame and shame. Everyone wants to heal themselves when they're suffering from health conditions. At the same time, just because we are attracted to alternative medicine and literally any other kinds of treatment doesn't mean that those treatments are safe or effective. That's an interesting question because in my book, I list about 9 pseudoscientific warning signs. And there's also alternative medicine tropes, which are kind of themes and are ideas that people can look to as signs that there might be getting duped. I'd say one of the biggest ones would, and probably the most subtle ones, is when you kind of notice a wellness promoter or pseudoscientific treatment promoter trying to sow distrust in mainstream healthcare. They're saying mainstream medicine doesn't work, but we have all of the solutions. We have the answers. That's kind of a big red flag, especially if the person offering the treatment doesn't have a license or they're not a credentialed health professional. So they're not a doctor or a nurse or a physician or a psychologist or psychiatrist or social worker. There's tons. I'd say one is being aware of testimonials on websites. So just because a person, Bob, Karen, John, said that this treatment works doesn't mean that it actually works. We need higher quality scientific studies to show that a treatment works. And so if a practitioner is putting testimonials all over their websites to say that their treatment works, that's a red flag. Another big one I'd say is when the claims of a treatment are really divorced from the broader scientific literature. So what I mean by that is just making really scientifically absurd claims, like in the world of energy healing, say the practitioner will say that they could balance your energy fields, which is just something that is not consistent with mainstream science and mainstream medicine. That's a really tough question as well, but a super important one. And there are scientists and researchers trying to figure out how to answer that question and how to implement programs for people to actually do that. For example, at the University of Alberta, there's a great science literacy course that people can take. And it's free and it's online and anyone can do it anywhere in the world. So that's one way to do it. I would also say at the individual level, it does get hard, but I would really encourage people to learn as much as they can about the nature of science and the nature of mental health disorders and their treatments, and to look to high quality, credible sources to get that information. Well, that's a relatively new area of research, and it's made news headlines all over the world lately, particularly in a bad light, where some people have even been susceptible to something called AI-induced psychosis, which basically means that when some people may be predisposed to psychosis or already experience psychosis, and then they start talking to these chatbots. And what the chatbots do is essentially confirm those psychotic beliefs and those psychotic symptoms, which makes it far worse. And so that there's a big caution around that. So I don't know the solution to how to handle that, except to tell people to be very wary of chatbots, especially if you're using it for your own mental health concerns. On the flip side, if there's good to come out of it, I suppose it could be used alongside evidence-based treatments to learn more about particular kinds of treatments like cognitive behavioral therapy, dialectical behavioral therapy, or mindfulness meditation. Chatbots can point you in a direction to find resources, to find more information about those modalities. Well, that's a big message in the book, is that it's not everyone, all of us are susceptible to falling for misinformation and pseudoscience. And the reason for that is because it's a really complex topic and it's multifactorial, meaning there's many different reasons that come together and interact to produce a perfect storm. So for example, we can look at different layers or different levels of analysis for why people fall for misinformation. One is the cognitive layer or the psychological layer, meaning We all have different kinds of thinking styles. This work or this theory was pioneered by Daniel Kahneman, who was a Nobel Prize winner. He talked about different kinds of systems in the way we think. So that one is very effortful, analytical, where we pause and we deliberate and we try to analyze the information in front of us. There's another kind of thinking system, which is more effortless and just intuitive and gut instinct, and we just evaluate information on that. Research shows that when we can access that other first system, the one that's more analytical and effortful, then we're less likely to fall prey to misinformation. So that's one level that's happening, but there's also other levels. We're all susceptible to motivated reasoning, which means we're not robots. We all filter information through our own belief systems and our biases. And when we interpret information, it's filtered through that lens. And so we're not objectively evaluating data. Everyone. And so we need to adopt a kind of intellectual humility that acknowledges the role of our beliefs in filtering information. So that's just the cognitive layer. There's also personality factors that influence why we fall for misinformation. For example, people that score higher on a personality trait called openness to experience are more likely to fall for it. There's also the social level where if we're online, we're all susceptible to the algorithms of social media. And social media is all about hyped up, overgeneralized statements and emotion-laden statements. And when we see and hear misinformation repeatedly over time, our brain isn't good at differentiating familiarity from the truth. And so we can fall for it in that way. And then, of course, there's also bad actors on social media and in popular media at large, which literally target us with misinformation and pseudoscience, whether it's your Instagram influencer or larger scale organizations. The placebo effect occurs in both alternative medicine and mainstream medicine. It's just the idea that someone experiences a beneficial effect after a treatment that's a quote unquote fake treatment, or it's inert, or it's a sham treatment, for example, a sugar pill or a psychotherapy that doesn't have any ingredients. Maybe it's just supportive counseling. So people will get better due to their expectations and due to their beliefs. That's what's called the placebo effect. The placebo effect is wonderful. We want to capitalize on it again in both modern medicine and alternative medicine. The problem, though, is that in alternative medicine, we don't want to encourage an approach to treatment that encourages deception, because while people can benefit from alternative medicine treatments due to the placebo effect, it's not right to actually deceive patients by not telling them the true risks and benefits of those treatments. And that actually encourages deception, and that's deceit, and that doesn't respect a patient's autonomy. Social media is not going anywhere. In fact, it's growing. There's an increase or a flood of misinformation, mental health misinformation and pseudoscience on social media. And so we need an equally rival army of mental health experts to combat that flood of misinformation. So I think that social media can be used for good, but it can also lead to a lot of negative consequences for people. For example, I took part in a study that analyzed one of the most popular videos on TikTok in a specific time frame in 2021 with the hashtag mental health. So we looked at these top 1,000 videos with the hashtag mental health on TikTok, and we found that 33% of those videos that talked about advice or information giving were misleading. Those 33% of videos were viewed over 1 billion times. So that shows how far-reaching social media can be in spreading misinformation. So we need people to get online, other science communicators that help combat misinformation. Well, I've wrestled with that question a lot, and the short answer is I don't know, because it's not entirely clear what's worse, a grifter with no license and no accountability, or a grifter with a license and feigned accountability. So, for example, in Ontario, which is a province in Canada where I am, the discipline of homeopathy is regulated. It's a regulated profession, and in order to call yourself a homeopath, you need to get licensed. But homeopathy is an unequivocal pseudoscientific treatment. It can't work because if it did, it would violate the laws of physics and fundamental principles in pharmacology. It's scientifically absurd. And so I don't know that regulating homeopathy is necessarily a good thing, except for the fact that in the wellness world, there are the supplements and homeopathic products are largely unregulated, which means that they can be contaminated with a lot of adulterants, and that's not safe or good either. So perhaps regulation has a role in the safety of the products, but what my fear is that it legitimizes bona fide pseudoscientific practices. Science is a wonderful thing because it's not one particular scientist doing science. It's countless scientists who are dedicating their lifetimes and their careers over decades to improving and accumulating body of knowledge that is essentially a component of science. And one mechanism that science uses to advance itself is something called peer review, which basically means other peers review your science, your experiments that you conducted when you submit it to a scientific journal. Basically means is that if you want to have a scientific publication published in a journal, you'd have to submit it, and then you get a whole host of other experts and reviewers who will read your work, and they grade it and they tear it apart with not trying to hurt your feelings. They're just trying to improve the manuscript and improve the science. And peer review is such a mechanism that's what I mean by a self-correcting machine, because it's hard to get past peer review because you got expert eyes on your work. I would just like readers to feel, after they read the book, to feel more empowered and emboldened to take their mental health into their own hands because they've learned the language of pseudoscientific grift, so to speak, so that they're more readily able to identify, spot it, and then avoid it. Well, there are tons. I'll give a few examples. If anyone's using the word quantum to explain a theory or to market their materials, beware, because quantum physics is a highly complex, deeply counterintuitive area of physics, that obscurity of which lends itself perfectly into the hands of grifters, so to speak, who get to market their treatments in that hazy, sciencey sounding language. So quantum is one. Another would be natural. When you hear someone saying that they're offering a natural treatment, what they're doing is an appeal to nature fallacy, which is essentially a logical fallacy. Just because something is natural doesn't necessarily mean that it's good. Poison ivy is natural, doesn't mean that it's a helpful treatment for anything. And then maybe lastly, I'll just say, another alternative medicine trope that I'd like people to be aware of is watch the languaging when people say that they treat the root cause, and that mainstream medicine only treats the symptoms, or they manage the symptoms, or they mask the symptoms, and the alternative medicine practitioners treat the root cause. That's a red flag, because when you dig deeper, you actually see that the root cause that they purport to being able to treat is often a false root cause or pseudoscientific root cause, such as unbalancing the energy blockages that are causing someone's depression, say, or trying to trace or trying to treat someone's post-traumatic stress disorder by using past life regression therapy to try to regress someone back to a past life to treat a trauma that occurred in that life. That stuff is quite clearly pseudoscientific. Well, I get that accusation quite frequently, and I find it kind of funny, especially because I'm a clinical psychologist, and the vast majority of clinical psychologists, in fact, all psychologists in Canada, including myself, don't even prescribe medication. We don't have prescriptive privileges. So that means Big Pharma isn't interested in us at all. We can't make Big Pharma any money. But when you take a step back, the accusation itself is just another kind of propaganda tactic used by the wellness industry, because again, the whole point is to demonize and to sow distrust in modern medicine and modern healthcare providers. And when they accuse someone of being a shill or a big pharma shill, they're trying to essentially demonize that person and saying they're bad, we're the good guys, we can help you. But of course, they can't help you by offering pseudoscientific treatments that are largely untested for safety and effectiveness. At the moment, I'm not working on any other writing projects. I'm enjoying full-time clinical work in a hospital setting. That said, my book is being translated. My book, Mind the Science, is being translated into a few different languages, one of which is Turkish, which will be available in print and in an ebook version, probably in about a year and a half or so.